raise my hands in prayer. Tears falling, carry my despair. Your memories linger, they fill my heart with grace. In every shadow, in every vacant place. Oh Allah, grant me strength to mend. I hope the angels look over you, my friend. Inshallah, we'll meet again in Jannah, where there's no end. Smile and go deep within. Though we're apart, you can count on me, my friend. In the gardens of the merciful, we will reunite under His mercy, bathed in eternal light.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Radio Al Ansar 90.4 and Marisburg 105.6 FM. I'm Shubnum Ismail on the Pulse show. So let's amp it up. Turning on top, turning all over. Hair loss affects millions, but there's hope. Welcome to our show where we are tackling the root of the problem with a top hair transplant surgeon. From cutting-edge techniques to real-life success stories, we getting the lowdown on reclaiming your locks. So let's get started. Welcome to the Pulse Show, Dr. Liam Carrey. It's great to have you with us.
Thank you so much, Shubnum. I'm happy to be here, and good morning to all your viewers.
Fantastic. So, listeners, Dr. Liam Carrey is a medical doctor and he has studied in the University of Cape Town. So, he is also a graduate with a degree from the University of Cape Town, born and bred here in Pietermaritzburg. He is actively involved in clinical medicine and healthcare entrepreneurship across KwaZulu-Natal. He started a multidisciplinary primary care clinic focused on delivering quality healthcare that is both affordable and accessible. Additionally, he owns and runs a dedicated hair transplant surgery practice. His hair transplant clinic focuses on evidence-based, patient-centered hair restoration, including medical management of hair loss and advanced surgical hair transplant procedures. So Dr. Carrey adopts a diagnosis-first approach, ensuring that each individual undergoes a thorough clinical assessment and scalp analysis, thus providing a tailored and patient-specific treatment plan. So listeners, let's get real. Hair loss can be a confidence killer. But what if you could turn back the clock and get your hair back? So we're going to get started and learn more about what Dr. Carrey has to offer us today. So Dr. Carrey, can you tell our listeners how did you get involved in your transplant unit?
Thanks, Shubnum. So I got involved in transplant surgery a few years ago, probably about 5 or 6 years ago, when I realized there was a huge need for hair restoration in particular. So although we do run a hair transplant surgery practice, as mentioned by you, we are diagnosis-centered. So a lot of individuals who are experiencing hair loss, depending on the degree of the hair loss and the type, require diagnosis, and this may be through just a simple consultation, maybe further testing like blood tests or biopsies. And then once we've done that, we then tailor a specific treatment plan to that type of hair loss. So not all our patients require surgery. Some require medical management as well. And it was through this that I found a love for hair transplant surgery and hair restoration in particular, just by the mere fact of the amount of confidence that you're able to restore for a patient doing these types of procedures and performing this kind of diagnostic work. So that gives me a lot of joy.
So, Doc, our listeners are really excited to know what is hair transplantation and how does it work?
So hair transplantation is actually quite a simple procedure, and it involves the surgical redistribution of permanent hair follicles from a donor zone to a recipient zone. So an individual will have an area of hair loss, which we call the recipient area, and then that will be the area that requires the hair follicles, of course, for us to transplant to. But we then need to assess the donor area, so an area of the scalp where we can actually take the hair from. So this donor zone requires some healthy hair follicles as well, and would require a certain density in order for us to provide the procedure and provide the correct density in the recipient zone. So there's two areas, a donor zone and a recipient zone. So we're moving hair essentially from one part to the other.
And who's a good candidate for a hair transplant?
So good candidates for hair transplant surgery are individuals who have essentially a stable pattern of hair loss. So as mentioned before, there's many different patterns of hair loss. We require your hair loss to be stable in a way where there is a quite a predictable trajectory about how you are losing your hair. You also need adequate donor site density. So, the analogy I often use with patients that I see is if we needed to tile a room that's a certain square meter size, we need a certain number of tiles. So the same is true for hair transplant surgery. If we have a recipient area, an area where a patient has unfortunately lost their hair, we need to assess the donor site to make sure it has enough density and is stable enough for us to actually extract hairs from that area and place them in the recipient site. And also, which is probably the most important point, is the client needs and patient needs realistic expectations. An individual, for example, who's 54 years old, that's experienced hair loss over the last 20 years, it's quite difficult for us to restore that hair to where it was when he was 20. Although we can give him good density and a good aesthetic result and cosmetic result, the density that he had at the age of 20, unfortunately, is not possible for us to restore with modern techniques as it stands.
So you also deal with patients coming in with a lot of emotions due to their age and the hair loss. And obviously, you actually plug them and get them sorted, which is fantastic. And Doc, how long does this procedure take?
So the length of the procedure purely depends on the patient and obviously the extent of loss. The more grafts that we have to transplant, the longer the procedure will take. It can range in from about 8 to 10 hours, and the patient is awake the entire time as we use a local anesthesia in order to provide anesthetic for the procedure. But during this transplant time, as the patient's not asleep, breaks are obviously allowed. If the patient needs to shift or shuffle during the procedure, that's also possible. Quick walks outside onto our patio. So at our practice, we've got a little patio and a balcony where patients can have a bit of a rest. We've got a lounge area as well where they get served tea and lunch and drinks throughout. So it's quite a comfortable procedure, but it is quite lengthy. So yeah, patients often don't complain of pain; they just complain about wanting to go home.
And what's the recovery time like? And as you mentioned, in terms of pain, is it non-invasive? What are some of the complications?
Yeah, so one of the biggest questions I get is it painful? And the question is yes to a small degree and no to a much larger degree. We use local anesthetic, as I mentioned before, so you do have some scalp injections that we give in order to create a what we call a regional block. So the area in which we'd be harvesting the grass from your donor site, we block that area out completely using some long acting anesthesia. So there's a bit of discomfort in the morning when we do the first round of injections, but after that, there's almost minimal to no pain during the procedure. And post-op, there's very little pain as well due to the anesthesia, which lasts a few days. And most patients find it to be very tolerable. In fact, no one's ever screamed or jumped off the bed. But yeah, you are awake, and it is relatively pain-free, in my opinion.
So it's not done in a theater setting. It's done merely at your rooms.
Yeah, so inside my hair transplant clinic, I've got a little minor ops theater set up within the consultation rooms. It's quite spacious, and this is to allow for a lot of staff members. So during the procedure, there's probably about 6 to 8 staff members present, including myself. So we've got a minor ops theater set up within our rooms, and adjacent to that, we've got a little lounge area for the patient to relax and have some food and drink.
So, Dr. Carey, let's talk about recovery time. How soon will the patient bounce back once they've had the procedure?
It varies from patient to patient, of course, but for the most part, you can probably return to work about 2 to 5 days after the procedure. Most patients return 2 days after, especially if they're remote workers. If you are client facing or your type of job requires you to be in front of a lot of people, most patients delay going back to work for about a week. And this is not because of pain or not being mobile. It's mainly because of the way that they look. Day 1 to 3, you can expect some redness of the scalp and also some swelling. And this is expected as we just performed a small surgical procedure to that area. So there's been a lot of trauma to the scalp as well. So redness and swelling is expected in day 1 to 3. And about day 7 to 10, there's a little bit of scabs that will form at the back if you've taken the hair from the back, and then also in the front. And then probably at about, I would say 10 to 14 days, you are socially presentable. You can go out in public and no one would even know you had a transplant. But yeah, it depends on the type of job that you have, and obviously your social circumstances, depending on when you would leave the house. But most patients at about day 10 are happy to leave, and those that are remote workers are back at work probably the day after the procedure, so day 2.
There's a question from one of our listeners. Are there any risk or complications?
So the risks are actually overall low, especially with the new techniques that we use these days. So before, we used to use something called strip surgeries, so follicular unit transplantation, where we'd actually extract a strip of scalp tissue from the back of the head. And this is quite an old technique and left patients with a linear scar posteriorly. These days we use follicular unit extraction, where we actually take individual follicular units. So essentially you can imagine little dots at the back of your head. And the risks are overall quite low. Infection is a possibility, as always, with any surgical procedure, but it's quite rare, given the mitigating factors that we apply during the procedure to ensure you don't get an infection in terms of the cleanliness, the environment, and of course the surgical procedure, so everyone is sterile. And we do put you on antibiotics post-op. Something that does occur is shock loss post-procedure. So patients do lose some of their shafts, the hair shafts that we transplanted, but the follicles remain behind. So there is still growth that will occur. But a lot of patients get a bit worried, immediately after the transplant, you've got hair in this area, and then over the next 2 or 3 weeks, that hair falls out. But the follicle, the main seed, remains below the scalp. So over the next couple of months, that will grow. And the other big risk is mainly due to planning errors, so surgical errors, not really, errors on the patient side, and that's just down to technique. So of course we've got parameters in place to ensure that the surgical technique is the latest and the most cutting edge, to ensure that you're not a victim of planning errors or any surgical errors. But other than that, it's quite a safe procedure, to be honest.
And in terms of cost, is it covered by medical aid? And typically, how much would something like this cost a candidate?
Yeah, so this is the other big question I get quite often. Unfortunately, it's not covered by medical aid. Medical aids in South Africa, and I think globally, hardly ever cover any cosmetic procedures. So, I mean, even down to Invisalign for your teeth or your braces, that's often not covered by medical aid. And this procedure would be the same. So, unfortunately, it has to be cash. At our practice, we do work with a financial service provider called MediWallet that allows patients to take small short-term loans for their medical procedures. This was actually born out of dentistry, but we've applied it now to hair transplant surgery. The typical cost of the procedure, depending on the extent of the hair loss, you're looking at about 35 to about 65,000. But using MediWallet payment scheme, you can probably get away with some monthly payments for about 24 to 36 months. And the first few months are interest-free with no penalties if you settle your credit earlier.
And what's the success rate for some of the patients that you've seen?
So the success rate is actually quite high. If we look at the clinical studies, and if I just apply it to my clinical practice, we're looking at about 90 to 95% graft survival. So that's how we would gauge success rate. Of course, in your procedure, when I refer to grafts, I'm referring to hair follicles. So one hair follicle might give you 3 to 4 hairs or 2 to 3 hairs. So if we had to transplant, let's just say 1,000 grafts, that might come across as about 2,000 to 3,500 hairs. And we look at graft survival. So how many of those grafts that we move from one place to another have actually survived? And we have a 90 to 95% survival rate. And the determinants of this graft survival are basically down to your surgical technique and also the graft handling. So we have a first in, first out rule, where if we've extracted grafts from the back of the head or wherever the donor site is, those grafts get labeled with a timestamp as well. So in the afternoon, when we are re-implanting the grafts, we make sure that those that came out first go in first. So the grafts spend the shortest amount of time outside the body, and this then helps them survive a little bit better. And then there are some patient factors that would indicate would influence the success rate, and that's just things like the blood supply to the area where we are transplanting the grafts, patient age, of course, the younger the better, and then also whether or not they're smokers or have any other comorbid diseases that would affect their ability to get the hair to grow. But generally quite a high success rate, and if a patient does come with some other factors that might affect success, we will obviously apply some techniques intraoperatively and postoperatively to ensure that they have a good result, take into account those factors.
Doc, I'm sure that you actually deal with a diverse mix of customers and clients coming through. So, how do you ensure natural looking results?
So yes, we do have quite a diverse mix of patients. We do a lot of Afro and ethnic hair as well, which is often not done by a lot of transplant clinics because it is quite a difficult hair type to transplant given the angulation and the curvature of the follicle. But we also do a lot of Asian and Caucasian hair as well. In terms of natural looking results, we believe this is probably the highest value skill in our practice. So it all comes down to the hairline design as well, especially if you're doing a frontal transplant. It's very important that we build in irregularities when we are transplanting so that, someone's hairline doesn't have like what we call a doll's appearance, where it's completely straight. Angulation is also quite an important factor that a lot of, I think, patients and transplant surgeons don't think about. So as your hair is moving from front to back, the angle of your hair changes. For example, in the very front of your hairline, the angulation there is about 10 degrees, but as we move back towards your crown area, as people refer to it, we're about 45 degrees angle there. Density is also an important factor. So you often have a softer, thinner density in the front of your scalp. And as you move backwards, it gets a little bit more dense. So that's where we put our 2, 3, and 4 hair grafts. And in the frontal zone, we just maintain single hairs. So hairline is probably the biggest leverage factor here. A poor hairline is immediately detectable. So we do our very best to make sure there's a bit of irregularity, to make sure we take into account angulation and density, to make it look as natural as possible. And that's basically the key principles and to ensure that we have a natural looking result.
Doc, does transplanted hair fall out?
It does, yes. Not in all cases, but in most cases. This normally occurs at about 2 to 4 weeks, and it's a normal physiological response to the transplant. So we call it shock shedding. So, I wish we could have a little bit of a presentation up, but maybe next time, if you do allow me back in the show, Shubnum. But the actual hair follicle itself, there's a follicle and a bulb, and there's a shaft. So your follicle and bulbs remain underneath your skin, and the shafts is actually what people see when they meet you. Those are your hair shafts. And when an individual gets a haircut, we're cutting those shafts. But the bulb remains underneath the skin, and that's essentially the factory that's giving rise to the shaft. So post-transplant, the shafts fall out, but the bulbs that we've transplanted remain in. Your follicles remain alive. And when the shock loss occurs, it's merely the shafts that are falling out. But the follicles that remain behind will be the ones that will give rise to regrowth. So, patients are a little bit disappointed in the first 2 to 4 weeks when all their hair that we've transplanted falls out. But over the next 3 to 6 months, they start to see the shoots of the follicles that have been left behind. So it's completely normal, yes.
It's absolutely beautiful to hear how this process works. And I agree with you that our listeners would definitely like to see a demo of the process. So, towards the end of the show, Doc, if you don't mind sharing your social media pages so they can look at videos and get more insight into what you do behind the scenes. In terms of length of time, how would one see full results, or when would they be able to see full results?
Yeah, so this obviously is a question I get quite often as well. I think they all are. But at 3 months, that's when you probably see early growth. So this will be like very fine shoots of thin hair. Remember, this hair is new hair. So although we've taken it from the back, the follicles are getting their process started again in their new location. So the hair shafts come out quite thin and not very dense. But as the months go by, from about 3 to 6 months, it becomes a little bit more noticeable as the shafts of the hair start to thicken up and strengthen up. And about 9 to 12 months, we start getting closer to being able to visualize our full result. And at about a year, that's when we can actually assess the efficacy of the transplant and how well the process went. Depending on the certain areas of the scalp, for example, the crown area, so just the top and back of the head, that can take up to 15 months to show results. We're looking anywhere between 12 and 15 months for you to get an actual result from your hair transplant procedure.
Listeners, have you just joined us? I'm Shubnum Ismail on the Pulse Show. So, are you struggling with hair loss? you are not alone. So, millions are turning to hair transplants for a confidence boost. So, joining us today is a top transplant surgeon here in Pietermaritzburg, Dr. Liam Carrey, who is sharing the latest techniques and his success stories. So, let's get your hair back. We're taking a short break. Stay plugged with us.
Al-Ansar, Durban, 90.4 FM, Peter Maritzburg, 105.6 FM.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickville Road, Overport. Simplex Radio, the name you can trust.
When disaster strikes, families lose everything in an instant. Homes destroyed, communities displaced, hope fades into uncertainty. Our Global Emergency Fund ensures we respond without delay, delivering food, water, shelter, and healthcare to families in need. To support our Global Emergency Fund, visit islamicrelief.org.za.
Getting you through your day. Radio Al-Ansar.
Doctors and guests on a medical files program will help you with any medical problems you have, giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
Under the stars, I raise my hands in prayer. Tears falling, carrying my despair. Your memories linger, they fill my heart with grace. In every shadow, in every vacant place. Lord, grant me strength to mend. I hope the angels look over you, my friend. Inshallah, we'll meet again in Jannah, where there's no end. Smile and laughter go deep within. Though we're apart, you can count on me, my friend. In the gardens of the merciful, we will reunite. Under His mercy, bathed in eternal light. Oh Allah, grant me strength to mend. The angels look over you, my friend. Inshallah, we'll meet again in Jannah, where there's no end. So
And we are back. Assalamu alaikum wa rahmatullahi wa barakatuh, listeners, and you connected to the Pietermaritzburg Medical Pulse Show with myself, your presenter, Shubnum Ismail, on Radio Al-Ansar 19.4 and Pietermaritzburg 105.6 FM. Just before the break, our hair transplant surgeon was sharing some amazing insights on the latest techniques. So stay connected as we diving deeper into the world of restoration. Welcome, Dr. Carrey, and it's great to have you on the Pulse Show today. Welcome, Dr. Carrey, and it's great to have you on the Pietermaritzburg Pulse Show.
Hi, Shubnum. Thanks for having me.
Fantastic. So, Dr. Carrey, can a woman also get hair transplant?
Yes, of course, women can get hair transplant procedures, but the selection criteria is often a little bit stricter. The good indications for women to get a hair transplant would probably be traction alopecia. So this happens to ladies who wear very, very tight hairstyles, like tight ponytails or braids or dreadlocks or any sort of hairstyle that creates a lot of traction on the front of the scalp, which then causes the forehead to appear to enlarge and the hairline to recede. So that traction alopecia is a good indication for females to get a hair transplant, and localized thinning as well. So if a lady has an area of the scalp that's localized and starting to get thin, we can transplant that area. What I do perform quite often is eyebrow transplants, in particular in females. And scarring alopecia is a possibility if it's inactive. So in females, though, the hair loss often is quite diffuse. So we often manage that a little bit better using medical procedures rather than a surgical procedure. But it is possible, yes. But again, depends on the patient.
And what's the minimum hair length required?
So there is no minimum hair length required actually for follicular unit extraction or the type of technique that we use. Unfortunately, when an individual does undergo a hair transplant, we've probably got to shave the entire area, so the donor site as well as the recipient site. Just this just helps with visualization for the surgeon, so myself and then also my team. When the hair is very long, it affects how we extract each follicular unit from the donor site and how we transplant it into the recipient site. So we normally have to trim the hair actually down, so the length is not really an issue for us. In females, if we're doing an eyebrow transplant, for example, and we're extracting hair from the back of the scalp, we wouldn't trim all their hair down. We would just trim down a section that they could easily conceal if they had longer hair. But generally, in male candidates, we require the whole head to be shaved.
Doc, advancements in medicine and technology just fascinates me. So, do you use advanced tech like robotics?
So robotics do exist in the field of hair transplant surgery. In particular, we have the ARTOS system. So technology is not really the limiting factor. It's more just the surgeon's skill, the planning, and the execution. So although robotic systems do exist, they just are not at the level where we need them to be. And also, I think there's a lot of mistrust from the patient side as well to know that a robot is handling their procedure from start to finish. So I do see in the near future robotic systems being an adjunct and maybe helping surgeons, but probably not doing the procedure from start to finish as yet.
And what advice you have for patients in terms of handling the scarring?
So the scarring is often minimal with the techniques that we use these days. I did mention earlier we used to use a strip technique called follicular unit transplantation, where we would take a strip of scalp from the back of the head and then process this down and then use those follicles from there. And that will leave someone with a linear scar, which can be hidden with longer hair, but in males in particular that would wear the hair a little bit shorter, it's quite hard to hide that scar. But fortunately, we don't use that FUT technique anymore. The latest technique that we use is follicular unit extraction, where I have a little device. It almost looks like a punch, and I punch each individual follicular unit out. And this leaves very tiny circular scars that are probably less than a millimeter, if you can visualize that. So they diffuse scarring on the back where I take the hair from, and they're barely visible as the hair grows. After about 3 to 4 weeks post FUE, so follicular unit extraction procedure, it's very difficult for someone to tell that someone else has had a hair transplant. So the scarring is actually minimal with the techniques that we use these days.
Doc, I have a question from one of our listeners. Is the hair transplant recommended for a person in their 60s with hereditary alopecia?
Yes, the transplant can be recommended for an individual in their 60s with hereditary alopecia. It depends, though, on the type of alopecia we're talking about. Very difficult for me to say absolutely yes or absolutely no. I would have to see that patient in person in order to give a proper assessment. But yeah, we have transplanted individuals in that age group before with quite a high success rate. Again, it depends on patient expectations. I did mention earlier that an individual in their 60s who was losing their hair, maybe through male pattern baldness, which is very common, can't really expect us to provide the same density they had in their 20s or 30s. But I think most individuals would be understanding of that. But yeah, it is possible as long as we can see the patient and assess.
I'm sure every patient coming through your doors is absolutely special to your practice. Do you have a special success story for one of your patients?
Yeah, I do. So I do have an individual. Her name is Nonjabulo, and she's happy with me sharing her name. She will be on our social media shortly. We actually have quite a few little video blogs from her journey over the last couple months, and she came to us with traction alopecia a few months ago, where she had been wearing braids and dreadlocks throughout her teen years and her early 20s, not really knowing the risks and what she was doing to her hairline. And she had actually quite a severe recession of the front part of her hairline, leading to quite a large appearance of her forehead. And this really affected her confidence. You know, she'd often wear scarves to cover her hair and was not even comfortable enough to take a scarf off at home. So her boyfriend of 2 years had never seen her hair before by the time we had met. And now she's about 9 or 10 months post procedure, and she's very happy. She's been sending us WhatsApp pics and WhatsApp messages. Just so excited with her new hairline, and yeah, her relationship is going really well, and her confidence is back. And we have a few stories like that. Obviously, not every patient has given us consent to share such success stories, so we're really appreciative for those who have, and those we will be sharing on our social media in the form of videos and still posts as well, so the public can see what kind of benefit they can get from such procedures if done correctly.
That's fantastic. And is it a one-time procedure?
Yes, for the most part, it is a one-time procedure. For individuals who have very extensive hair loss, so mainly in males who've got lost the whole top part of their head, and they're just left with hair on the back and sides, we often do split the procedure into two small procedures, normally a few months apart. And the reason we do this is just to maintain the donor area. There's, something called over harvesting, which shouldn't be a common practice, but it does occur around the world, where surgeons tend to over harvest the donor area. So they take too many hairs out in order to provide an aesthetic result or cosmetic result in the recipient area. And this is something that we desperately try to guard against in our practice, because by over harvesting the donor area and giving the patient hair in the recipient site, a few months down the line, the patient may come back and say, my donor area is now thin, and we've got nowhere to take hair from. So in a very large transplant procedure where a patient requires quite a large transplant in the recipient site, we try and split those into two smaller procedures just to preserve the donor area and allow for better surgical planning, because it's horrible to create one problem to solve another. So leave someone thin in their donor area in order to give them a very dense recipient site. So that's why we split up the larger procedures. But for the most part, I would say 90 to 95% of the time, it's one procedure.
Dr. Liam, I must actually commend the team, including yourself, for the care and expertise for each individual walking through your doors. I mean, I can actually sense the compassion that goes into the work that you do. So that's commendable. And how do you advise patients on post-op care?
So post-op care is something that we guide patients and walk patients through post-surgery through WhatsApp, phone calls, and also in-person consultations. It's quite a simple post-op care regime. It depends on, the reason why you had your transplant to start off with. So there may be some medications that we would apply post-operatively for the year up until the patient has a full result that we require to take every day or a few times per week. But generally, it's just a gentle washing protocol. We try to avoid any trauma to the grafts. So the first 7 days is critical in terms of ensuring the recipient site stays healthy. So where we transplanted the hairs, so patients have to be careful about exercising, nothing really touching their head. If they've got little children, they've got to be careful around little children, because of course they'll see an area of interest and want to grab and poke and prod, and obviously bumping their heads against cupboards and whatnot. We've had it all. So you want to avoid trauma to the grafts for the first week. We actually do your first wash post transplant in our practice, so 6 days later. So for the first 6 days, you can gently stand under the shower with your hand above your head to make sure that that strong jet of water doesn't affect the grafts. But in terms of the actual washing of the scalp, we do your first wash 6 days post procedure, and it's at that point that the grafts are quite stable. And then at home, we advise you on exactly how to wash your hair, and exactly what kind of headwear you can wear for the first 2 weeks, 3 weeks, and 4 weeks. And thereafter, your life pretty much just goes back to normal with no real particular care to the site that's required besides the shampoo and maybe the medication you may be on.
Listeners, you connected on the PMB Pulse show with myself, Shubnum, Ismail, Radio Al Ansar, with Dr. Liam Carrey. So we're going to have a quick advert break, and when we return, our hair transplant surgeon will dive deeper into restoration and the incredible transformations. So stay with us. Don't go anywhere.
For the first time, I can dream again.
The Africa Muslims Agency Orphan Hope Program provides the food, clothing, and basic support needed by thousands of children across the world. Every child deserves a chance at a hopeful future.
For 15,000 dirhams, you can transform our lives with the AMA Orphan Hope Program.
Africa Muslims Agency, empowering, educating, inspiring.
This and only this is Nightline. Nightline is the only program that allows you to listen to the opportunity to voice your opinion on any matter or any topic that concerns you. Also on Nightline, we interview the famous, the not so famous, and infamous. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Brother Muhammad Varyawa, and with me in the studio is Dr. Anwar Jiwa. Join us every Saturday night from 8:30 p.m. till 10:30 p.m. on Nightline, the program designed especially for you, the listener.
Are you going for Hajj or Umrah? We at Al Ansar Shop have got you covered. From ihrams, ihram belts and kitabs. We also stockist of Zamzam water from the wells of Mecca, dates from Medina, all at a ridiculously low price. Visit us at 207 West Road or call us on 031 208 1601. Al Ansar Shop, your one-stop Islamic shop.
ادعو إلى سبيل ربك بالحكمة والموعظة الحسنة وجادلهم بالتي هي أحسن. Invite all to the way of your Lord with wisdom and beautiful preaching, and reason with them in a way that is best and most gracious. Join Shabir Pasha every Saturday at 7 p.m. on the show Dawah Dynamics, and every Sunday on the Dawah Chronicles at 9 p.m. Remembering the companions of Prophet Muhammad, peace be upon him. Join the discussion, analyze the life, sacrifices and contributions of the Prophet's companions, and learn from their experience. Radio Al Ansar welcomes your feedback. If you have a broadcasting related complaint, please put it in writing and address it to the head of the complaints committee. Include your full name, contact details, a clear description of your complaint, and any supporting documents. You can email your complaint to feedback@alansar.org.za. That's feedback@alansar.org.za. Or bring it in person to our Peter Marisburg office at 240 Ortman Road, Willowton. Your input helps us serve you better.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Under the stars, my hands in prayer, tears falling, carrying my despair. Your memories linger, they fill my heart with grace. In every shadow, in every vacant place. Oh Allah, grant me strength to mend. I hope the angels look over you, my friend. Inshallah, we'll meet again in Jannah, where there's no end. Smile and laughter go deep within. Though we're apart, you can count on me, my friend. In the gardens of the mercy.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Radio Al Ansar 90.4 and Peter Marisburg 105.6 FM. I am Shubnum Ismail on the Peter Marisburg Pulse show, and today we are focusing on the bold truth and how we can restore your hair. Joining me in studio today is Dr. Liam Carrey, hair transplant surgeon, who's sharing his expertise. Welcome back, Dr. Carrey. How are you doing today?
Well, Shubnum, and hello to all your listeners.
Fantastic. So, Doc, can you enlighten our listeners in terms of can one get a transplant for beard and eyebrows?
Yes, it is actually possible to get a transplant for beard and eyebrows. So for the beard in particular, we use coarser grafts. So we try to get this from the back of the head as well, depending on the individual and how much of an area in the recipient site they require, how large it is. And for eyebrows, it's pretty much the same as well. It's just a bit of a finer, more precise angulation because, of course, if you pay attention to an individual's eyebrows, the hair grows in a very natural, angled form from the medial, so the middle of the brow, to the lateral edges of the brow. But both are possible, yes. It just requires a bit of a higher technical skill for natural results, but definitely possible, and we do perform them.
And how does hair density impact the procedure?
So hair density is probably one of the most critical constraints of the procedure itself, both in the recipient site and also the donor area. So, if a patient has, obviously they would be noticing some thinning in the recipient site, so the area where they want hair. The more dense it is, the better for us, because that would mean that we would add less hair to that area in order to get a good cosmetic result. So that's in the recipient area in terms of density. In the donor area, if we have very high density, that's also a good position to be in, because that allows us to provide a better cosmetic outcome, because we've got a lot of hair now to take out without leaving the donor site thin or less dense. Low density individuals, so patients that come with generally low density, so their donor site is of low density and their recipient site requires a lot of hair, we've got to then prioritize strategic placement to provide coverage. So in that area, in that instance where we've got low density all around, so the donor site is quite low in density and the recipient site is almost bald, we've got to be very careful and strategic about where we place the hairs in order to provide coverage, and we often have to use some other adjunctive procedures like scalp micropigmentation, where after about a year after the transplant, the individual undergoes a little bit of tattooing, which is a specific type of tattooing in order to create the visual impact of having density if they do have low density all over post-transplant.
It fascinates me that the medical professionals are bringing more innovation into, into the South African market, and our customers and patients don't have to travel abroad to Turkey or Dubai and have these procedures done locally. So, can you tell our listeners, how do you stay updated with latest techniques?
So the field does evolve quite rapidly, and obviously, if you stagnate, you then are open to poor surgical outcomes, in my opinion. So it's more for me about attending international conferences. So there are international hair restoration societies that exist, and bodies that basically scan the available data, and also key opinion leaders that exist that also give their input into what the industry should be doing and what the new standards are. I also think that surgical mentorship is quite important. So, I've got a mentor in Kenya that has been invaluable in my learning and growing over the last, 5 to 6 years. I mean, I still lean on him quite heavily when I have difficult cases or particular questions I'd like answers to. And I think that's true for the field in general. Without mentorship in medicine, I think a lot of doctors wouldn't be anywhere. Medicine is the type of field where skill is actually handed down, because nothing beats experience. So those of us that are experienced in the field, have a particular responsibility, I feel, in medicine to make sure that our experience and our skill is handed down. So mentorship is a huge, huge part of me staying up to date. And then also continuous case reviews. So procedures that I complete in my practice, and colleagues in the field that I have that also complete procedures, we review these cases and we see where we could have done better or what could have gone better, or patient factors as well as surgeon factors. And this process is dynamic and is constantly happening. And I think that's what allows us to stay up to date with the latest techniques and also to make sure that our surgical skills remain sharp.
Doc, there's a question from one of our listeners. Can stress affect transplant results?
Most definitely. What we know in medicine in general about stress is that stress has a very, very huge impact on the body's physiology, just generally, so how the body functions. Stress can cause hair loss itself as well. We call this telogen effluvium, where an individual can lose their hair due to medical stresses or even psychological stresses. So, some individuals, for example, during the COVID period that were unfortunate enough to be admitted to hospital and in hospital for a few weeks did experience some hair loss as well. And if you go into a particularly stressful period in your life, even things like pregnancy or another important life event, your hair can get a little bit thin, and you can notice some loss of hair as a result of stress. So in terms of stress affecting transplant results, definitely possible, indirectly, but possible.
So, what's the most common misconception about hair transplants?
I think the most common misconception about hair transplant surgery is that it is going to be something that I just do once and I never ever pay attention to my hair ever again. So people think that it's a silver bullet. So I'm speaking in particular with traction alopecia, which I see a lot of. Females have lost their frontal hairline, and once they've gotten the procedure done, it's very difficult for them not to return back to their previous hair practices that landed them in this situation. So applying the braids, the dreads, the tight ponytails. We need to be mindful that once the procedure is done, that hair is your hair. It's natural hair. It came from your body, but whatever landed you in the situation that required a transplant, if it was a particular hair style or styling technique, we have to curb those so you don't end up in the same position.
And are there any tips for maintaining transplanted hair?
Yes, I mean we use a lot of tricks and certain approaches in order to maintain transplanted hair, and this is where medical hair restoration comes into effect. So, like I mentioned earlier, not all patients require a transplant, and even individuals who have gotten a transplant post-transplant, we do some procedures like platelet-rich plasma, where we draw some of your blood and spin it down in a centrifuge, and we use the plasma component of your blood, which is full of growth factors and is obviously natural, to inject into the transplant site to ensure that it grows. And we also use certain medications like minoxidil and finasteride to stop the loss and also to stimulate growth in that area. So there are a few mechanisms that we apply post-transplant to make sure that you get the absolute best result possible.
Dr. Liam Carrey, thanks for shedding light on treatment options for our listeners. And to our audience, remember, knowledge is power and hope is stronger. So, Doc, how can our listeners get in touch with you? Where are you based in Pietermaritzburg? And are you happy to share your contact details or your email?
So if listeners just Google Dr. Liam Carey hair transplant, they would find my practice in Hilton. So it's not difficult to find me at all. And through that, they'd get my WhatsApp number as well. I'm happy to get my WhatsApp number out on air, but if they just Google me, Dr. Liam Carey hair transplant, they should find me quite easily. And then in terms of social media, they can find me on Instagram at omnia.health. So omnia.health. That's the name of the practice in Hilton. Or I have a personal professional Instagram, and it's at Forget the Apple on Instagram, and they can find a lot of videos there of me talking through some hair transplant procedures and also some patient reviews as well. So yeah, I don't think it'll be too difficult to find with a simple Google search.
Thank you, Dr. Carey. It's been fantastic having you on your show, and I'm sure we'll track and we'll have further discussions later in the year. Listeners, the Pulse Show is all about medical matters. Have you or someone experienced a stroke or head injury? So Open Hand Support Group, together with the Stroke Survivors Foundation, will be hosting the next support group in Pietermaritzburg on the 21st of April between 2 to 3. You can contact myself, Shubnum Ismail, on 082 360 so you can actually reserve your seat with us. Alhamdulillah, listeners, we have reached the end of today's episode, and it's been an inspiring journey. May Almighty Allah grant us guidance, health, and strength. And as the Quran says, indeed with hardship comes ease. I'd like to thank the technicians, both Durban, Pietermaritzburg, and to you listeners for connecting on the Pulse Show. Until next time, stay informed and stay empowered. And that's a wrap from myself, Shubnum Ismail. We will see you again next week. Jazakallah for listening. Assalamu alaikum wa rahmatullahi wa barakatuh.
inshallah. Me